Now, before we kick off, I just wanted to introduce you to myself initially. My name is Fiona Harding, and I am Thrive Tribe's implementation lead for the new service here in Hampshire. And joining me today, I also have Dr. Richard Pyle, who is Thrive Tribe's clinical lead. And that's just one of the many hats that Richard wears, but I'll let Richard tell you a little bit more about himself in a moment. And I've also got Hannah Butler, who is our digital product owner for Gloji. So first of all, I just wanted to tell you guys a little bit more about us and who we are. Thrive Tribe have been commissioned by Hampshire County Council to deliver the county's Tier 2 weight management provision starting on July the 1st. We as an organisation have been delivering preventative healthcare for well over 12 years now. And most recently, we've been doing that under the client-facing brand of Gloji, which is what you'll see here today. Now, as an organisation, our mission is to empower over 1 million people to change their behaviour and thrive, doing so through a wide range of healthy lifestyle interventions that we deliver across England at the moment. So far on that mission, we've managed to help 328,000 people in total, 56,000 of them through health checks. We've helped 59,000 of them to lose weight, and a whopping 114,000 of those have quit smoking through Thrive Tribe's support. So in today's session, Dr. Richard Pyle is going to kick things off for us by sharing his thoughts with you in relation to the effects of obesity on the patient, the practice and the system. And we'll then follow up with more detail in relation to what the Gloji service offering will be in Hampshire, who is eligible, how to refer, and how we'll work with you and your practices and your colleagues to help maximise referrals and hopefully reduce obesity rates in Hampshire. So I'll hand over to Dr. Richard Pyle for his section.
Thank you, Fiona. Just to briefly introduce myself, my name is Richard Pyle. I'm a GP partner from Hertfordshire, and when I'm not being a GP working in my practice, I'm also a specialist practitioner in cardiology and lifestyle medicine. I work for Herts and West Essex ICS as their lifestyle medicine and prevention lead, and also I'm the Thrive Tribe clinical GP as well. And really, this brief conversation, which hopefully, or presentation, which I hope you won't find boring today, is really, it's not just about obesity and reducing obesity and its impact upon the patient, your practice, the system, but actually it's the consequences of it, isn't it? So it's preventing cardiovascular disease, it's preventing diabetes. They're the really big examples that I'm going to be focusing on briefly. In essence of where we are now, you know, we know that greater than a third of UK adults have pre-diabetes, which has tripled over the last 8 years. Over 4 million people have diabetes. 90% of that are people with type 2 diabetes. And we know that the drug budget costs alone to the NHS is significant, 2.5 billion on drugs and greater than 10 billion on the complications of diabetes. We know that when it comes to cardiovascular disease, which is on pretty much every single ICS's prevention agenda, that it causes 25% of deaths under 75, and that it has significant implications, not just for patients, but for us. Let's talk about us for a moment as primary care. Let's be a bit selfish. Patients with complex cardiovascular disease have about 18.5 appointments a year. And that's even more than people with just type 2 diabetes, who have about 13.5 appointments a year. And we feel, you know, primary care is overstretched. Patients feel abandoned, to quote an article from the BJGP. And realistically, this is only going to get worse unless we can do something to change the situation in which we're in. And of course, that I haven't really spoken very much about the patient there, but the costs to the patient clearly are physical, mental, and financial as well. So what are the challenges about our eating well? Well, we have a toxic relationship with food, both individuals and as a society. And I could talk all day on this topic, but thankfully for you, I'm not going to. But whatever we have been doing is clearly not working. Over 40% of UK adults are overweight, over 25% obese. That's from 2021. Obesity causes hospital admissions. It causes 8% of global deaths, which I worked out is about 80 times the rate from violent crime. When someone gets stabbed, tragic though it is, and you see it across the front page of the newspapers, we don't get 80 times the press about obesity and the consequences of that. And the key factors in that are inequality. Let's be honest, it's not all about bad choices. It's about the playing field and it not being level. It's about knowledge. It's about the cost of food. It's about bad guidance historically, the pushing of low-fat diets from the 1950s and 60s, which with hindsight, most people now acknowledge was probably a mistake. And maybe we should be looking at diets with probably fewer carbohydrates in them. And it's big food, the way that the food industry tries to promote its products and keep us all addicted to them. And then when you combine that with conflicting messages about diet, you only need to go on Twitter to see the sort of debate that rages backwards and forwards between people who are polar opposites, you know, the meat chewing carnivores and the vegans. And so it sheds a lot of heat but not a lot of light. And obesity itself is clearly complex in both its causes and its consequences. So these are the challenges, that the context in which we're having this conversation. So the question is, you know, normally if I was presenting a slide to you that you could look at, at this point I'd be going option A, option B, option C, option A, doing nothing. But let's be honest, option A, doing nothing, is not an option. So we need to think about what we're going to do differently. Now, could you share the slide, please? My one slide. This is essentially just to challenge us all a little bit today about what we're told is, next one down, thank you. Thank you. What we're told, what we are incentivized to do, what we are told to consider is good evidence-based practice in primary care, and then the areas where maybe we haven't been as historically convinced of the importance of lifestyle measures, but I want to challenge that today. So if you look at a website called the nnt.org, if you've got a low risk of cardiovascular disease, less than 20% Q risk, in order to prevent a heart attack, 217 patients have to take a statin for at least 5 years for that to occur, 313 to prevent a stroke. No lives are saved. And yet you only need to give that to about 200 people for one of them to become diabetic, and maybe 20 to 50 or so to get muscle damage. And yet these are things that we're incentivized to do in our contracts. When it comes to clopidogrel, 200 to prevent a recurrence of a stroke, 333 to prevent death from a stroke or a heart attack. Again, we're told to do this for everybody. Primary prevention of mild hypertension, rather disappointingly, you don't save any lives by controlling mild hypertension, but you do only need to give it treatment to 12 people for one of them to fall over, break something, or develop an acute kidney injury. And yet when we move down this table from the red through the amber to the green, we can see the benefits of lifestyle intervention specifically focused on weight loss. So significant weight loss to prevent major morbidity. If 7 people lose significant amounts of weight, 1 doesn't become diabetic. If 13 lose weight, 1 avoids hypertension. Perhaps most tellingly, if 14 lose weight, 1 doesn't suffer from lifelong disability. Let's just consider the cost implications personally into the system of that. With a modified Mediterranean diet in people who suffered from moderate to severe depression on drugs under the care of health professionals, only 4 people need to take that diet in an Australian study called the SMILES trial to go into remission for depression. And this is perhaps one of the most relevant stats. If you're put on an intensive low-calorie diet for type 2 diabetes, even if you have long-standing diabetes, you only need to treat 2 people who will stick to this diet for one of them to completely reverse their diabetes, not reduce the drugs, reverse their diabetes. And if you're a newly diagnosed diabetic, those figures are 1 for 1. Thank you. You can take the slide down now. So the reason that I'm talking about this is because this is why it's really important that we do it in practice. Now, the question is, how do we do it in practice? I'm a GP, I'm busy. It really gets up my nose when other people invite me to do their jobs for them or to do things that I never used to do before, bearing in mind the pressures that we're all under. But so how might we engage with, local weight management service, which is both meaningful for the patient, but not too massively impactful workload clinically? And I would say there's the option for the targeted approach. So I don't apologize for saying that as GPs and healthcare professionals, we are well placed. We are often the right person to start that conversation. We don't need to be the person that a patient sees time and time again, but we might be in that moment someone that they trust, sitting in front of them at the right place and time to at least prime them, get them to think about the next few steps and to signpost them on. And of course, it doesn't have to be a GP that does that. It could be your healthcare assistant, it could be your nurse, it could be the social prescriber or the health coach that you have in your PCN. Other options we could take, well, you could do some searches, find people who've got the appropriate BMI to qualify for weight management services, which we'll go into more in a few minutes, and invite them by sending them a link with your preferred system. We use Accurix in our part of the world, either to click on a self-referral link into the system, or to invite them to look at a web page, or to ring back and speak to the care coordinator, or the healthcare assistant, or maybe their favourite GP, to discuss whether they're interested in taking things forward. And essentially, this use of the practice admin team can free up clinician time, which I'm sure we're all in favour of. We want to do the right thing, but we know our resources are limited. And it is just worth mentioning, and I know you're not all motivated by money, but practices are incentivised to make use of weight management services, and whether it's referring into Gloji, whether it's referring into the NHS Diabetes Prevention Programme or the NHS Digital Weight Management Programme, you get £11.50 for every coded referral that you do. So therefore, you get to do the right thing and earn money at the same time. And then, so I'm going to finish off because I feel like I've been talking for quite a while, but just to consider, what future do we want for all of us? So for our patients, obviously we want less disease, longer lifespan, but perhaps more importantly, longer health span, improved physical and mental health, less time spent in appointments, requesting drugs, taking drugs, getting side effects, having monitoring appointments, going for blood tests, having a sense of empowerment and control, and reduced acute episodes of acute illness and admissions as a result. What does it mean for us as practices? Well, our patients are going to be happier, and I know sometimes it's hard to imagine a happy patient, but they are out there, and we could get more of them this way. It is going to free up capacity, it's going to free up resources, it's going to reduce our prescribing workload apart from anything else. Imagine all those people who are no longer on repeat prescriptions that don't need to go through your practice. It's going to lower drug budget prescribing. Some of you may be aware of Dr. David Unwin, the low carb GP. In his practice, since he's been helping people reverse their type 2 diabetes, he's saved tens of thousands of pounds, and the evidence is out there for you to digest. And for us, it's a better quality of life. Let's be selfish. It's a better quality of life for us because we have the capacity and we're able to manage our workload more appropriately, and we can focus in areas where we feel perhaps our skills will be better spent. And I'll be honest with you, this is a marginal gain, but it's a gain. And everyone on this call knows that there are no magic bullets for the NHS. And it's a bit like the British cycling team. It's margins. It's just shaving things off. Every single thing that we can do to make our practice more efficient and use our skills better, and obviously have happier patients, is clearly desirable. And that's about it from me. I'll be available to take some questions at the end. Thank you.
Perfect. Thank you, Richard. That was excellent. Some really interesting stats there as well. So next up, I'm going to hand over to Hannah Butler, who's going to talk you through a bit more in relation to the service offering that we'll be introducing to Hampshire from July 1st.
Thank you, Fiona. So I'm going to be talking a little bit today about the programs that will be available to your patients. So we have 3 programs. This is kind of 3 options for the client. The client will only be able to choose kind of one of these. The first being Slimming World, which is our face-to-face offering. Next slide. The Gloji Lose Weight program, which is our digital offering. And then lastly, Gloji Move More, which is our physical activity offering. And I'm going to kick off by talking a little bit more about option 1, Slimming World. So Slimming World is evidence-based and NICE guidance compliant. We are partnered with Slimming World to provide the face-to-face adult weight management service, so Tier 2 adult weight management. Clients joining Slimming World will get access to a 12-week program. They'll have weekly kind of supportive group sessions with an expert consultant to kind of provide advice, kind of share experiences and talk about kind of the week just gone. Alongside this, they also get access to the Slimming World podcasts. And if we switch to the next slide, perfect, the Slimming World app, which has access to loads of tools, tips, recipes, activity videos, articles, and as you can see on the right here, a digital food planner, which includes a barcode scanner to help with healthy food choices and tracking. And then if we move on to option 2, so Gloji Lose Weight. So this is a tier 2 adult weight management program as well, but digital. So it's a mobile first web app. And what I mean by that is it will be accessible by the new Gloji Hampshire website and can be used on both a mobile phone and a desktop computer. It's a 12-week video-based program that kind of promotes healthy behaviour change and obviously weight loss. Alongside the kind of digital part of the product, clients get access to 12 weeks of health mentor support to help kind of promote that behaviour change even further. I'm actually just going to share my screen for a second here and give you guys a little bit more insight into Gloji. So this is the homepage of our kind of Gloji product, and you'll see at the top here we signpost to Gloji Gym. So Gloji Gym is a free online gym with both on-demand and live exercise classes that all Gloji Lose Weight clients will get access to as part of the programme. We then have the My Path page, which is where their kind of main 12-week programme will be housed. So this program is kind of covering 24 topics. New content is unlocking weekly, and those topics look at kind of the core areas of a client's lifestyle. So sleep, movement, alcohol, nutrition, and mind. So as you can see here, I've unlocked a couple of steps already. I'm a little bit behind, and you can kind of see the kind of idea of the topics that kind of come up throughout the program. As I mentioned, it's video based, so if I click into one and give you an example, each topic is kind of made up of a couple of short videos, and we use kind of reflective questions, SMART goals, and habit stacking to kind of empower clients to make those lifestyle changes that result in weight loss. I will take you to the Mo Progress page now, which is where clients can track their weight in a format that suits them, so kilograms or stones and pounds. And we have our Explore section where you can view a number of different articles, again, kind of sectioned by those core kind of lifestyle pillars we look at on Gloji, and a recipes section with breakfast, lunch, dinner and snack options. And then I can stop and take you back to the slides, if that's all right. Thank you very much. So alongside all of that juicy digital stuff clients will get access to, they also will get a couple of downloadables. So on the left here is the Eat with Gloji guide. So they'll be able to download this, use this digitally, or print it out if they wish. So this includes information around meal planning, portion guidance, and kind of hunger and fullness scales, as well as a selection of the recipes that you could see on the product. And then there's the Gloji journal. So this allows clients to track their behaviours against those kind of core pillars that we talk about across Gloji. So the mood, the movement, the sleep, the alcohol, and the nutrition, so food. And then they will also get access to emails. So as I mentioned, the content unlocks weekly, so 2 new topics a week. They'll get a reminder letting them know when that next content is available, and also articles kind of signposted linked to the product, relevant content that's kind of to do with that week. There's also an email chain that they will get following the 12 weeks to keep them motivated, kind of promote that kind of continued weight loss and maintenance after 12 weeks. And then just a few nice stats on Gloji Lose Weight and all the positive changes we have made so far for our clients. So 87% lose weight. And as you can see here by the rest of the stats, we've made some really positive kind of improvements to clients' lifestyles as a whole. So 82% report improvements in mood as a result of the programme, over 60% increase their physical activity and portions of fruit and veg. So just a little flavour of all the great things we've managed to do so far for our clients. And then on to option 3. So Gloji Move More is a tier 2 adult weight management program with physical activity. So it's not launched yet. It will be launching from September 2023, although clients will be able to sign up onto a wait list as of July. It's a 12-week program. Clients will get access to one of their chosen sports. So you can see the options here. The first 4 are in the community and the last one being online. And as part of this, they will also gain access to all of the kind of digital stuff that I just shared for Gloji Lose Weight. They will, in community sports, attend those sessions weekly, and then kind of get the support from a health coach in the community in that time frame as well. And for online, there'll be kind of online activities they need to complete and challenges, and they'll get regular contact with a health mentor. This, also important to note, is free at the point of access as well, so completely free for all. And then just finally, a little bit of background in terms of our history around physical activity delivery. We are an experienced provider in this area, and Fat, which is the leading men's weight loss provider that provides football, has been commissioned in Hampshire for the last 5 years. And I think that's everything from me. I, again, will be able to take questions at the end around the programmes, but I will hand back to Fiona.
Perfect. Thank you, Hannah. That's great. So next up, we're going to have a little look at eligibility and who you can refer into Gloji from July the 1st. So in order for a patient to be eligible, they must be a resident of Hampshire or registered with a Hampshire GP. Now, this excludes those living in Portsmouth and Southampton. In terms of BMI, they need to have a BMI of 30 or above, or a BMI of 27.5 and above for Black, Asian and other ethnic minority groups, along with those with specified long-term conditions. We'll share more information with you on another occasion in relation to what classes as a specified long-term condition. For in terms of age, you can refer anyone aged 16 and above, albeit self-referrals are only eligible for those 18 and above. 16 and 17-year-olds can only be referred by a GP or a healthcare practitioner. Clients who are pregnant are not eligible, as are clients who have a severe psychological morbidity and or a eating disorder. So next up, we'll be looking at how to refer. As we mentioned, Gloji will be operational from July 1st, and we'll be accepting referrals from that date as well. Any referrals that you make up to midnight, the night before the 1st of July, into the current provider, Weight Watchers, will remain on Weight Watchers, and all new referrals from the 1st of July will transfer over to Gloji. Gloji Move More, as Hannah mentioned, will be launching in September, but we are, however, going to start accepting referrals onto a waiting list for that pathway from day one on July the 1st, because we're very mindful that there'll be a lot of people excited to take part in physical activity as opposed to the other two pathways. Now, in terms of how you technically make that referral into the service, there are 3 methods. The first method is through your clinical operating system, namely EMIS or System 1, and you can see an example here of the template that we'll be adding to your system. We're currently going through the process of getting that uploaded, and our ambition is that it'll be there from day one. However, if we haven't managed to get the referral form uploaded to EMIS and System 1 for July 1st, we will be able to utilise option 2, which is a healthcare referral form, which, next slide please, if that's okay, which is a healthcare referral form that will sit on our website and will allow you to refer your patients through to us via that method as well. And finally, we have a third option where you can simply signpost your clients to self-refer themselves through the Gloji website. You can see here an example of the website. It provides them with an overview of each of the 3 service offerings that we have. They can go into a bit more detail to find out more about each of the offerings, and they also have the ability to undertake a short quiz if they're not quite sure which of the pathways will be the correct pathway for them. So next up, in terms of working together with you, we'll be producing a digital pack of marketing materials, which will be shared with everyone who attends today's webinar and all GP surgeries. That pack will include instructions on how to request printed materials as well for those that would like hard copies, and more detail on our service offering and how you can refer your patients into Gloji. Also, as we become more established and begin to develop those partnerships with you, we can also start to support you in terms of providing SMS and letter templates alongside digital content for social media that'll help you to engage with your obesity register and your online social channels as well. So finally, what to do right now? Firstly, we'll be very grateful for your support in promoting Gloji across Hampshire from the July 1st. We're very much here to support you in any way we can from a partnership perspective, and we're more than happy to come out and meet yourself and your colleagues to answer any questions you might have in relation to the service offering and how you can promote it to your clients. So if you are interested in having one of those meetings with us, please do just drop us an email on support@gloji.uk, and our team on the ground in Hampshire will be more than happy to come out and tell you a little bit more about us as well. For any of your colleagues who couldn't make today, please do let them know that we are running the same webinar again on Monday, June the 26th. And booking details will be available. You can see them on screen there, and we'll also be sending out these slides at the end of the webinar. So you can share these slides with any colleagues you think might be interested in that webinar. For those of you who would like to stay on and ask any questions, please do. We'd love to hear from you. Simply use the chat function and ask anything that you might want to know about Gloji moving into Hampshire from July. And also, if you've got any ideas in relation to how we can best serve you and help you maximise referrals as well, please do share any thoughts that you might have, so we can help make sure that we make Hampshire a happier and healthier local authority. Otherwise, thank you very much for attending, and we're very much looking forward to working with you in the future.